Hello, I'm Dr. Michelle Cebulko from Peacock Pediatrics, and today I would like to talk to you about ADHD. ADHD is a chronic condition of the brain that makes it difficult for children to control their behavior. ADHD includes 3 categories of symptoms. Number 1, inattention, such as difficulty listening, paying attention, or completing tasks. Number 2, hyperactivity, such as being in constant motion, trouble sitting still, being very squirmy or fidgety. Number 3, impulsivity, acting and speaking without thinking, trouble taking turns, or trouble waiting for things. Not all children with ADHD have all of these symptoms. Research has shown ADHD may be caused by a number of things, including brain anatomy and function, genetic factors, significant past head injuries, prematurity, or prenatal factors such as drugs, alcohol, or nicotine, or in rare cases, toxins such as lead. There is no evidence that ADHD is caused by eating too much sugar, food allergies, immunizations, or different food additives. ADHD affects almost 10% of school-age children in the United States. Boys are more than twice as likely as girls to be affected. If you're concerned that your child may have ADHD, he or she may need to be evaluated. The pediatrician will determine whether your child has ADHD using standard guidelines developed by the American Academy of Pediatrics. There is no one single test for ADHD. The process is somewhat lengthy and involves a lot of information gathering and several steps. The pediatrician will also perform a complete physical exam and a neurologic evaluation to rule out other conditions that may affect your child's behavior. There is no cure for ADHD. However, there are many good treatment options that are available. These treatments include a long-term management plan with monitoring and targeting outcomes, education, parent training and behavior management, and teamwork amongst the doctors, parents, teachers, and the child. Occasionally, medication will be used as well as counseling. ADHD treatment uses the same principles that are used to treat other chronic health conditions such as asthma. There is no scientific evidence that these methods work, and they are not recommended, including visual training, EEG biofeedback, applied kinesiology, megavitamins and supplements, or treatment of yeast infection. Left untreated, ADHD in some children will lead to serious, lifelong problems, such as poor grades, trouble with the law, failed relationships, or difficulty keeping a job. ADHD is a lifelong condition. However, by developing a structured environment, focusing on strengths, and taking medication when needed, adults with ADHD can lead very fulfilling, productive lives. If you have concerns that your child may have ADHD, call and schedule an appointment with Peacock Pediatrics. Thank you.